Hi everyone, welcome to Lab 2, the Appendicular Skeleton. Once you're logged into Primal Pictures, we're going to begin in 3D real time with the shoulder and arm. Okay, so we're going to start with the humerus. Let's get rid of ligaments and connective tissue, just so we can see the bones on their own. Okay, in the first lab, I showed you how to use the search function to find things that you're looking for. Because you know how to do that, I'm just gonna sort of point things out today to give you some guidance as to all the things you need to be looking for. But certainly when you're going through the lab on your own, use the search to put pins on things and make sure you know exactly where everything is. Okay, so we're gonna start with the humerus today. All right, so we are looking at the anterior view of the left humerus. So your greater tubercle is located here, lesser tubercle right there, and your intertubercular or bicipital groove is running between them. Okay, so right there. Then we'll move to the bottom, and why don't we do a search for you here? Okay, so we'll start with trochlea. All right, ooh, that's zoomed in very close. Let's zoom out a bit. There we go. Okay, so again, still the anterior view, and now we're looking at the parts of the elbow joint. So you're going to have your trochlea here, and you can see that trochlea is a little bit of a broader surface, okay? Has a greater vertical length compared to the capitulum, which is over here. Then we have our medial epicondyle and lateral epicondyle. Okay, we're now going to move, let's get that out of the way, down to the radius and ulna. We're going to be able to do some of this in this section of Primal Pictures, but then we'll have to move down to the wrist and hand to see the bottom. So we're going to focus on the proximal end of the ulna and radius to start. So we have our head of the radius. Okay. The little bump here is your radial tuberosity. And on the ulna, the biggest feature that we have here is the olecranon. So let's spin everything backwards. So now we're looking at a posterior view. Okay, so there's the olecranon process of the ulna, big bump on your elbow. And that's going to fit into the olecranon fossa on the humerus. Okay, so we're now going to move into the forearm, wrist, and hand section of Primal Pictures. All right, here we are. So again, we're looking at an anterior view, okay? So let's move down to the distal end of the radius and ulna. Let's zoom in a little bit. And up we go. Okay, so at the distal end, we can see the radial and ulnar styloid processes. And if you need to double check which bone you're looking at, just zoom out a bit, okay? Or you can remember that the radius is on your thumb side because the radius is rad. So if you give a thumbs up because you're rad, that's your radial side. Insert dad joke here, but that's, you know, if you remember it, then that's fine. Okay, so then this is going to be your radial styloid process, this little pointy bit here, and your ulnar styloid process is a little pointy bit here. And you can feel those down at the distal end of your radius and ulna just as you're getting into the wrist. All right, so now we're going to move into the carpal bones. And we'll zoom in for this one. So again, make sure you're going through these and getting a good look at them. We will not label carpal bones on a test all by themselves. We will keep them in context like this, okay? And we'll probably just highlight it like that and say, name the highlighted bone. So, scaphoid, lunate, triquetrum, and then sitting on top of it, sitting anterior, is pisiform, okay? Hamate, and you can see that it has that little hook right here, hook of hamate, capitate, trapezoid, and trapezium. Then we move into our metacarpals. Starting on your thumb and moving laterally, you have the first, second, third, fourth, and fifth metacarpal. And now we move into our phalanges. So all 5 digits are going to have a proximal phalanx. So proximal phalanx 1, 2, 3, 4, 5. Middle phalanges only exist on digits 2 to 5, so not on the thumb. Okay, so middle phalanx, 2, 3, 4, 5. And then the distal phalanx for all 5 digits. Okay, so distal phalanx of digit 1 or of the thumb, distal phalanx of digit 2, 3, 4, 5. Okay, you can call them thumb, index, middle, ring, and little finger if you wish to, but more common scientific practice is to call them digits 1, 2, 3, 4, 5, okay, beginning with the thumb always. Okay, so we're gonna now move down to the lower body. I encourage you to examine these structures, the pelvic structures on both the male and the female pelvis. We'll just pick one for now, just to do a quick walkthrough. But certainly I encourage you to look at both, as the pelvises will look slightly different, and we will probably ask test questions on both. There we go. Okay, so we'll start with the separate bones. Okay, so you're going to have your ilium here, pubis in here, and ischium running from here around to the back to there, okay? Here's your ischial tuberosity, the bone that you sit on. So if you do yoga, they call that your sit bone, so your ischial tuberosity. Pubic symphysis, which is right here. It's labeled interpubic disc in this software, which is just another name for pubic symphysis. We encourage you to usually call it pubic symphysis. If you prefer in lab to say interpubic disc, that's fine, or really anywhere, but the traditional name for it is pubic symphysis. Anterior superior iliac spine. So your iliac crest is going to be all along here, okay, your iliac crest. The anterior superior iliac spine is going to be right at the front, okay? So that's when you feel your hip bone, that's what you're feeling, anterior superior iliac spine, okay? And that's going to be a big site of muscle attachment that we'll come to soon. And I think that's actually it for our structures in the pelvic region. So we'll close up and we're going to move into hip and thigh. Again, let's remove the ligaments. And as we get further into the course, we'll talk more about some of these ligaments, but for now, let's just get them out of the way. Okay, so we're gonna start on the femur. So the head of your femur is located here, okay, and that's gonna fit into the acetabulum of the hip bones. The neck of your femur, to me there. Greater trochanter, big bump here, and lesser trochanter is located there. Then we go right to the bottom to get to the medial and lateral epicondyles. Okay, so medial epicondyle, lateral epicondyle. Okay, and you can get a nice back view there too. Okay, and now we're looking at the condyles on the back, which I believe are not on your lab list. Oh, sorry, they are on your lab list, sorry. So the condyles are on your lab list. So medial condyle, lateral condyle. And it's very likely we would label these in a posterior view. Okay, so now we are actually quickly moving out of this and down down into the ankle and foot, and we have a few things on the tibia and fibula that we still have to get a look at here. So some of these structures you'll be able to see in two different aspects of the 3D real time, so make sure you get a good look in both. I'm just doing a quick walkthrough so we get a view of everything, but certainly try and see as many views of everything as possible. Okay, so let's start with the tibia and fibula. And actually, this is a good time to mention, in a lab like this where we're jumping between a lot of different body regions, you may find that if you do a search, like let's say, here, if I zoom in like this, and then do a search for, or even, I guess if it's like this, if I do a search for specific things about the femur in this view, it may come up as not being there, and that's only because it's not in this picture, okay? Or it's because it's labeled in the knee and hip and thigh pictures, but not in this one, okay? So if it's on the lab list, it means it is in primal pictures. You just may not be in the right region of the body to get a good look at it. Okay, so again, I'm gonna get rid of, oops, ligaments and connective tissue so we can get a nice close look. Okay, so let's start with the tibia. So for the tibia, we are going to have, sorry, we are looking at a right leg here, okay? So the fibula is lateral. So fibula, lateral, okay? So here's your tibia. So you're going to have medial and lateral condyles. The tibial tuberosity is located here, and that's where your quadriceps muscle is going to insert. And then down at the bottom, we have a nice big bump here, which you can feel on yourself, and that's the medial malleolus, okay? The lateral malleolus is located here on the fibula. And the only other thing I'll point out is the head of the fibula, which is there, okay? And that's where it's going to form a joint with the tibia. All right, let's zoom in on that foot and ankle. There we go. Okay, so bones of the ankle and foot. So we'll start at the heel with the calcaneus. Okay, let's get a nice view there. All right. And then sitting on top of that is the talus. Okay, and the talus is going to form a notable part of the ankle joints here with the tibia and fibula. Okay. And you'll notice there are a few kind of little teeny bones like this guy and that guy over there. Okay, these are called accessory bones. And some people have them and some people don't. Sometimes people have numerous accessory bones in this area, and they would be embedded in muscles. It doesn't seem to matter to form or function whether you have them or not, but they are there. So in case you're wondering what those are, that's what they are. All right, let's have a look at the superior view of the foot. So we have navicular and cuboid, and then we have our three cuneiforms, okay? So lateral, intermediate, and medial cuneiform. Then we move into our metatarsals. Just like when we're looking at the hand, we're gonna start counting with the big toe, okay, also known as the hallux. So we have metatarsal 1, 2, 3, 4, 5. And then we have the same phalanx system as we had in the fingers. So we have a proximal phalanx for all 5 digits. Okay, middle phalanx only for digits 2 to 5. And then a distal phalanx for all 5. Okay, and I'll point out on the at the base of the hallux, the base of the big toe, you have a couple of little guys here called sesamoid bones. Okay, let's label them both. And those add a little additional support because you are supporting all of your weight here, okay? And when you walk or when you run, a lot of additional force is placed right on this spot. So we actually do have a couple of tiny little bones there called sesamoid bones that just provide a little additional support. Okay, that's it for this lab. So I certainly encourage you to spend lots of time seeing all the different views of all of these structures, and we'll see you next lab.